Good day everyone, I am Ellen Acid, Bachelor of Science in Nursing. So for today's video, we will be doing the parenteral medication. So it has a common routes, the enterodermal, the subcutaneous, the intramuscular, and intravenous medication. So for today's video, we will be just doing the enterodermal medication, the subcutaneous medication, and intramuscular medication. So first we will go through the intradermal medication. So it is the intro of a solution by means of a syringe and needle into the superficial layer of the skin or just below the epidermis of the skin. So let's start. So first we'll check the physician's order and assemble all the equipment and assess the patient's history of allergic and note the substances the patient is allergic to and the normal allergic reactions. Then we will wash our hands and assemble the equipment. Then we will verify our patient and we're gonna do our 3 check of our MAR and we're gonna do our 5 rights, and now we're ready to draw up our endodermal injection. So remember, when we're dealing with the vial, we have to check for the expiration date. So I have here the vial. And the other thing I want to point is, first is this a tuberculin syringe. So this is a very little syringe. And this whole thing is a 1 ml. So for the comparison purposes, so this is our 5 ml syringe and a 1 ml syringe. So this whole thing is this equivalent or just a little bit in the syringe. So this is not hold a lot of fluid. So now we're just ready to draw up. So we're going to first we will puff off the cup with the alcohol wipe. And we're going to draw back our air. So we will draw back air. And the amount of air we draw back is the amount of fluid we are going to take out of the vial. So let's say for a pretend it's 0.3 ml. So we're gonna pull back a 0.3. So we have it 0.3. So we're going to inject that. And then we're going to flip upside down and pull back, and we will pull back a 0.3. So inject, then we will flip upside down and pull back a 0.3. So the best is to do this at the eye level so I can see it and make sure we're at the right place. So 0 point. So we have here 0.3. And now we are ready to do our endodermal injection to fluid. No. So we're ready to inject it in our patient. So I have here a vegetable. So we will find the location. So we will find a location. So example, this is a forearm. So we will go through we're going to go like from here, we're going to 1, 2, 3, 4 fingers down. So on the forearm, so making sure that the patient arm is flat and resting on the surface like a table. Then about this point, you're gonna wipe it. Wait for it to dry. Don't blow on it. Don't wave your hand over it. Just wait for it to dry. Then we're gonna take our syringe and we're going to inject. Remember, we will barely 5 to we will barely above the surface 5-degree angle to 15-degree angle. So and there you go. We have this needs to be read within 48 to 72 hours. And of course, we're going to dispose this in the sharps. Next, for the subcutaneous injection. So for this example, I have here also a 1 ml syringe or the insulin, because that's actually a very common subcutaneous injection that you will give. So we're just going to use the insulin for this, just to pretend. So because we're using the insulin, I have what we call the insulin syringe. So I have here the insulin syringe, just to pretend. So this looks like a little bit different than your other syringes. Actually, this is in units. And we have here, you can see there says a 100 units. So we're just going to pretend we're going to give 10 units. So we're going to get 10 units of insulin. So first, I have here the vial. We will puff off, wipe alcohol, and then we're going to draw back 10 units of air, and then we'll inject it. We will inject we will inject, then we will got to be really careful with these needles. So now we're going to invert it and pull back. So we will put 10 units out. 10 units. Oh shit. So pull 18 units. And here we go. You have 10 out. And next for this, we're ready to go give it to the patient. And then we want to find like a fatty part at the back of the upper arm, or in the abdomen, or in the front of the thigh, or at the back. And we're going to pinch. We're going to pinch, and we have this injection. So first we're going to wipe it off with our alcohol. With the alcohol wipe, and then we're going to go at the 45 to 90 degree angle and inject to pinch. So this is, and inject, and then let go, and then discard your sharps in the container. And actually, one last thing I want to point out about this subcutaneous injection is this something like an insulin, where they're going to be getting it multiple times a day, and you want to make sure to rotate sides, so don't give it in the same place every single time. That's just going to cause skin breakdown, and the med is not going to work as effectively for your patient. So make sure you rotate sites with a subcutaneous injection. So next is for the intramuscular medication. So when drawing medication up from a vial, don't forget to record the lot number and the manufacturer name, and you also want to make sure to check its expiration date. So this is a vial I've used before. It's not really real, it's just for pretend, for the demonstration purposes. So let's just pretend it's a vaccine. Okay, so we're gonna give the flu shot or something like that. So we would puff off the top of it and wipe it within the alcohol wipe, and then we will get our syringe and our needle ready. So I have, this is not safety needle, so if you have access to a safety needle, which is the kind that has a little device in it where you can lock it after you give the injection, definitely use that instead. I just don't have access to it, so that's why I have this kind of needle. So before we draw up from the vial, we need to instill air into the vial. So let's say that our medication record states we're giving 0.5 ml. So 0.5. So now we're ready to inject air into the vial. And now at the same amount, we will turn it upside down, and at the same amount of 0.5 ml of air, you need to pull back 0.5 of the medication. Oh, why? And next is one other thing I want to mention is we should always label our injections, because if this was, the fall on the floor, or you saw it on somebody's computer on wheels, and you weren't inside the room. You weren't inside the room, and it's just some random unknown clear liquid, right? We could don't know what it is. So either take a piece of tape and write as a name of medication. Write a name of medication on it. And actually there has actual little stickers that are medication labels that you can put in the syringe. So just a safety thing, you should always think of it. So there you go. So to do an intramuscular injection on an adult, you're going to usually use the deltoid, and to find the right location, you're going to locate the acromion process, which is like the bony part right here, and then you're going to go 2 fingers down, so about right here, and then you're going to go, and then where we're going to go give the injection. So first let's alcohol it off, and when we use the Z-track method, we're going to use our hand to move the skin like this, to move the skin, while the other hand holds the needle. So wait. So we will going to use our hand to move the skin, while over other hand holds the needle. So this is our intramuscular injection. So no, it's not. This is our intramuscular injection. So it is labeled medication, and we're going to give it double up. So we will use our hand to move it off to the side, and then at the 90-degree angle you can inject. See? So that's our parenteral medication. Oh.